Welcome back to Knowledge Hive, where we believe knowledge is a service and sharing it empowers all of us. I'm your host, Leisa Sims. I'm the CEO of Knowledge Hive. And have you ever thought about what freedom really costs? For freelancers, solopreneurs, and independent creators, that freedom, set your own hours, choose your clients, and live life on your own terms comes with one big, unavoidable question. What do I do about health insurance? Today, we're going to dive deep into freelancers and health insurance in 2025, a topic that sits at the crossroads of independence, financial planning, and well-being. Because the truth is, while more people than ever are breaking free from the 9-to-5 grind, the safety nets that used to come with traditional jobs just haven't evolved fast enough to keep up with these new trends. But here's the good news. Freelancers are figuring it out creatively, strategically, and collectively in some cases. By the end of this episode, you will not only understand how freelancers are managing their healthcare in 2025, you'll also have a roadmap of real strategies backed by data, success stories, and some new models that might surprise you. But before I get started, I want to share my, well, that's cool story, thanks to Knowledge Hive. If this is the first time you've joined me, let me do the little 30-second pitch on what is Knowledge Hive after all. Knowledge Hive is an on-demand marketplace for top-tier professionals that are willing to share what they know with others. So if you're coming into the platform for the first time and you need help, you are a seeker. And if you're one of our amazing experts on the platform, you are a hiver. Because of my background in technology, I reached out to this seeker that actually engaged one of our hivers to see if he would talk to me about his experience working with our hiver and tell his story. And he agreed, and he said, it all started with an email. Simple, routine invoice from a longtime vendor, or at least that's what it seemed. This seeker is the IT director of a 300-person precision parts company, and he was alerted that $180,000 had left their account before anyone realized something was wrong. He'd received a call from the CFO 2 hours after the incident happened, who had fortunately called the vendor that they'd done all this business with due to the amount and was told that they had not sent that invoice. So it was panic and chaos and a very clear problem. Their mid-sized business was running without real cybersecurity leadership. So enter one of our amazing hivers. He is a Chief Information Security Officer currently. He doesn't have an office. He doesn't have a team and branded polos. He just brings a whole lot of experience and a laptop full of threat intelligence tools. So within 24 hours, the hiver was on the case. The hiver led with an outcome justification for his fees. I mean, he told my seeker that, you've already paid $180,000 for your last security lesson. Well, let's make sure you never pay that tuition again. So he took that in and the engagement was approved and away he went. His first move wasn't to deploy fancy software. He gathered the CEO, IT, finance, and operations on a single call, and he said, let's figure out what happened and why it was possible. It turns out the attack was a classic business email compromise. A vendor email had been spoofed. One employee had reused a personal password. No multi-factor authentication, no alerts. It was just a perfect storm. So over the next 72 hours, the hiver traced the breach. He froze the transaction and, fortunately, secured the accounts. So he didn't stop there. He also launched a risk visibility program that included regular vulnerability scans, employee training, and very clear data classification. He developed a long-term incident response plan with quarterly drills, metrics, and board-level reporting. I think this was the best part of the conversation I had with the IT director. He said, last month, The Hiver's work was put to the test. A phishing campaign hit dozens of mid-sized manufacturers just like them across the Midwest. And one of the company's engineers received a Microsoft login renewal email, flawlessly executed. She hesitated. She remembered the training that she'd received, and instead of typing her password, she reported the email, and the attack was blocked. So blacklisted, done. Two other companies in their industry weren't so lucky. He told me that he had a friend in one of the other companies, and they'd had production halted for 72 hours. So his company, 0 downtime, 0 data loss, 0 ransom. He told me they didn't just have better security, they now had a culture of vigilance. He told me that he had asked for a CISO for years, but they couldn't afford it. And so unfortunately, they paid a huge price for a lesson learned. He said, "I never said I told you so, but I thought it a lot." So Oliver didn't stay full-time. He remains still to this day their fractional CISO. He does a quarterly kind of adjustment and roadmap, monitoring threats, and he brings his CISO level expertise in. Fractional cost, full impact. In 2025, freelance CISOs are filling a critical gap. They bring their expertise without the bureaucracy. They act fast, they speak human, they teach teams to defend themselves, and today, one click can cost a company everything. That partnership isn't just smart, it's essential. So if you're a business leader navigating cybersecurity, remember this story. I love this story. Okay, back to our topic for today. Thanks for indulging me. Let's start with where we are right now. According to a 2024 report by MBO Partners, over 72 million Americans identified currently as freelancers. That's nearly half of the U.S. workforce engaged in some sort of independent work in some capacity. And I don't know, get this, that number is expected to grow past 80 million by the year 2028. So it's just continuing to grow. So it's not just a trend, it's a transformation. But here's the catch. With this independence comes personal responsibility for everything that used to come from HR. From payroll taxes to retirement plans and, of course, healthcare. According to the Freelancers Union, health insurance is still the number one concern among full-time independent workers. In fact, nearly 1 in 5 freelancers still go uninsured because of cost or confusion about their options. That means millions of talented, driven, independent people are doing something incredibly brave, but also incredibly risky every day. So let's unpack how freelancers are managing, innovating, and even thriving in this new world of healthcare independence. The reality check. Why is this so complicated? If you've ever tried to shop for your own health plan, it's not super simple. Between open enrollment windows, plan tiers, subsidies, deductibles, the entire process can feel like a second job. According to CMS, the Centers for Medicare and Medicaid Services, the average monthly premium in 2025 for standard silver plan is about $530 before subsidies. And the average deductible, around $5,000. Now compare that to what someone working in a corporate job might pay. Their employer typically covers 70 to 80% of the premium and often negotiates much better rates for the group just across the board. So for freelancers, those benefits disappear the moment you go solo. That's where creativity and community have really kind of stepped in over, I'd say, the past year to two. I think it's easiest to understand when you hear actual stories of what some of our Hivers and their network have done to tackle this problem. It's come up in conversations so many times since we've launched the company. Case study number 1. So the Marketplace Maverick. I'm going to call this little freelancer, she's a UX designer based in Colorado, and I'm going to call her Maria. Protect the names of the innocent. When Maria left her corporate job in 2022, she panicked about losing her health insurance. She tried Cobra, but the monthly cost was nearly $800 a month, completely unsustainable for a new solopreneur. So she turned to the ACA marketplace at healthcare.gov and started running numbers. Because her first year freelance income was variable, she qualified for a premium tax credit. Her monthly premium dropped from $520 to about $230. And she found a silver plan that included her preferred clinic. So fast forward to today, and Maria said it's the best decision that she's made. Here's what's important about her story. By estimating her income carefully and using the marketplace calculator, she unlocked subsidies that made coverage realistic. This approach, using the ACA marketplace with income-based assistance, is now the single most common strategy among U.S. freelancers. According to Prudential's 2024 report on self-employed health coverage, 65% of freelancers who are insured bought plans through the marketplace, and about 58% of them qualify for some level of subsidy. So case study number 2. This is more of the collective solution. So looking at a different path, the power of groups. In New York, an independent video producer, I will call him Andre, joined the Freelancers Union health plan. This is a traditional insurance. It's a collective purchasing structure where members get access to vetted health plans at group rates. By joining, Andre gained access to plans that saved him about $200 a month compared to what he'd found on his own. Freelancer cooperatives and associations like this are really kind of becoming a movement. In 2024, organizations like Indie Health, Freelancers Union, and Coworker Collective reported record membership because freelancers are realizing that community bargaining power matters. These collectives often include not just health coverage, but mental health resources, telemedicine options, and even dental and vision, all bundled for members. So let's see. Case study number 3, the hybrid innovator. There's a full-time copywriter who combines direct primary care with high-deductible health plan. I will call her Janelle. Direct primary care is a growing trend. Instead of paying per visit, Janelle pays her doctor a flat $90 a month fee, which gives her unlimited visits, virtual consults, and same-day appointments. For everything else, surgeries, emergencies, etc., she carries a catastrophic plan through the marketplace. Her total monthly health cost, around $380 a month, significantly less than the $650 average for comprehensive coverage. This model gives her predictable monthly costs and personalized care, and according to American Academy of Family Physicians, DPC enrollment among self-employed individuals has grown over 40% in the last 3 years or so. It's a model that fits perfectly for freelancers. It's flexible, it's transparent, and it's personal. What about new trends and emerging models? What's next? There are a few trends reshaping the freelance healthcare landscape, especially starting this year in 2025. There's platform-based health benefits. Several of the gig and freelance platforms have begun piloting partnerships with health benefit providers. They're negotiating group rates, embedding health coverage options into the freelancer dashboards, and offering it out to their folks. It's early, but it's promising. Then there are AI-based plan matching. Startups like Stride Health and Catch Now use AI to help freelancers find plans that balance cost, network, and care usage, often saving an average of around $400 a year is what they claim. HSAs, freelancers are leaning into HSAs as a long-term strategy because contributions are tax-deductible, growth is tax-free, and withdrawals for health expenses are tax-exempt. It's one of the few triple tax advantage tools available to self-employed folks. And then there are some states that are actually providing some state-level innovations. States like Washington, Colorado, and New Jersey are experimenting with public option plans offering lower cost coverage backed by state support. These could change the game for independents over the next few years. Definitely keep an eye on that as well. The mindset shift. At its core, managing health insurance as a freelancer isn't just about picking the cheapest plan. It's about shifting from employee thinking to entrepreneurial thinking. It's realizing that your health coverage is not just a personal expense, it's a business investment. Because when you take care of your health, you protect your productivity, your creativity, and your longevity and the work that you love. Freelancers who thrive long-term treat healthcare planning as part of their financial foundation, right alongside taxes, savings, and business insurance. So if you're listening right now, maybe you're between contracts, maybe you're about to go full-time freelance, or maybe you've been independent for years but still feel uneasy about your healthcare, here's your takeaway. You have options, you have tools, and you have a community. Start with healthcare.gov to estimate your real costs. Explore collectives or associations like the Freelancers Union. Look into direct primary care if you crave more control. And above all, don't wait until you need care to get covered, because independence shouldn't mean insecurity. It should mean empowerment. Thanks for tuning in to Knowledge Hive, and please share this with someone navigating their own career pivot who just needs a little bit of help with this type of enablement. I'd also love to hear your freelance or consulting journey. You can connect with me on LinkedIn or at knowledgehive.co. New episodes drop every week, so don't forget to subscribe. And if you haven't already, go create a free profile on knowledgehive.co. Got questions or topic that you'd like us to cover, which, by the way, that's where this one came from today, drop it in the comments below. I'll take them seriously. Until next time, we are Knowledge Hive, and we are Knowledge as a Service.